Alright, yung gabi sa tanan. Welcome back sa aton nga reality. Kaya halin kita sa Christmas break. So, subong balik naman kita sa realidad which is padayon sa nursing life natin. Okay, our sorry, nalipat ko mag-introduce. I am Josh Mariascano, Amorsolo, RN, and I will be your professor for this SEM sa health assessment. Okay, agyan nato nga importante si health assessment sa aton nga nursing life. Okay, let's start agad. G agad. Okay, health assessment session 1. Let's go. Okay, definition of health. Definition of health. Health is what? Health is a relative state in which a person is able to live to his or her. Okay, his or her potential and includes the seven facets. Okay, seven facets. So not only guys, nga ang health is health lang gid like wala sipon, something like that. Healthy ka na agad. No. Okay, seven facets siya. Relative, meaning ga-relate siya sa isa kag isa. So, anong una? Physical health. Ginamba ko na. How the body works and adapts. Okay, physical health, normal naton. Okay, normal nga health. Physically health. Okay, emotional health. Okay, positive outlook and emotions channeled in a healthy manner. Sorry, wala ako naka, none. Very good. Positive outlook and emotions channeled in a healthy manner. So, positive outlook and emotions, guys, emotional health, ano, bala, sad, bala ka mo, depressed, no? So, it also include, it is also part sa aton nga health overall, okay? Seven phases, dala na siya si emotional health. So, dapat emotionally healthy man kamo, okay? Not only physical but also emotionally healthy. Okay, next is social well-being. Okay, social supportive relationships with family and friends. So ano bala ang imo nga health or ang imo nga relationships among family and friends? Healthy bala or nag-aaway ka mo or something like that. Cultural influences, okay, favorable connections to promote health, culture, spiritual, living peacefully, morally and ethically. Dira na masulod si church. Okay, kung involved ka mo sa church or involved ka mo sa isa ka religious organization, of course, na dira siya masulod, spiritual influences. Environmental influences, favorable conditions to promote health, environmental, developmental, how one thinks, solves problems, and makes decisions. So, it might connected or factor ni siya kung paano kita gipadako, of course, kung paano mag-develop ang aton nga brain, kung paano kita manungdom, and paano mag-solve some problems and make decisions. So, part na siya sa health naton, of course, kay syempre, dala siya bla overall, kung paano kita mag-make decision, makontek na siya kung paano kita mag-handle sa aton nga health overall. Okay? Health is a sum of these facets. Ara, ginamba ko na, liwaton ko naman, as I've said last sem, ang nursing, liwat-liwat lang. Ginambal yan naman. Ang ginambal ko na, ang health, katinguban, or some of these facets. So, sang pito nga ni ang health naton. And is not solely defined as the absence of disease. So, mananginamba ko, hindi lang bangod nga wala ka sipon, wala ka ubo, healthy ka na. Or eating right, kamo na siya. So, but rather by the contribution of all dimensions. So, kung ako magstorya ako sa mga boys or sa mga um, sa mga sa mga tropa ko na gid no amo na magstorya ko sila, it's your department. So kada department na siyang namin ko, so dimension ni siya kun diri sa nursing. So paano ko siya paagi, so for example mangkoton ko ang friend ko, men kamusta imo physical health, o naga-jogging ka mo na di na masakit ka permi, something like that, o kamusta imong relationship towards imong family, no? Mga towards imong friends, sa imong coworkers na dira na ma-connect sa social well-being, kamusta imong emotional health, something like that, no? 'Di ba? May enough bala imong support, enough imong mga friends and families, no, nga magbulig sa imo kung may mga problema ka, something like that. Okay? And of course, amo na, mabalik mo dyan, spiritual influences, nagasimba ka, something like that, amo na siya. So, kada department or facets ng life naton, contain bond that's called your health. Okay? Health assessment. Health assessment, nursing health assessment entails both a comprehensive health history and a complete physical examination. which are used to evaluate the health and status of a person. So, ano ang purpose? Sorry, purpose. Liwat. The nursing health assessment tells both a comprehensive health history, complete physical examination, which are used to evaluate the health and status of person. So, a health assessment, ginaobra naton para mag-check sang what ara nakabutang health history and of course sa complete physical examination sang patients naton kay nga halin sang una hasta subong guys pinakauna gid na niya sa process sa nursing process or any kind of process guys is assessment. Are we clear? Hala guys, boring. Ayan, but anyway, balik kita. The nursing health assessment involves a data, systematic data collection that provides information to facilitate a plan to deliver the best care for the patient. Guys, isa-isahin. Wow, Tagalog si sir. Isa-isahon nato ni later. Ang ari, di ba, assessment, tapos diri ginambay naman may plan, no? So, agyan na naton later. Okay, ginhimay-himaya lang na. Pero ihimay-himay yun tapos later. Okay, the first part of the assessment is the health history, which also incorporates the seven facets. Okay, dira na ma-connect si seven facets kung makuha nato ng health history. Health history kay nga amang ko tuntang patient nga nakalabot di sa hospital. Of course nagsakay sila eh. Pero nga aari di siya sa hospital subong. Okay, ano ang rason nga ari di siya nga ang naglabot sa muni nga something like that. History nga anak nga aari di siya subong naga-seek siya sang care. Okay, are we clear? Okay, wala may gasabat. The nurse asks pertinent questions to gather data from the patient and or family. Past medical records may also be used to collect additional information. Learning about the psychological, social, cultural, guys, amo magyapon na again. The second component assessment is physical examination. Pagtapos naton sang health assessment, okay, tapos naton assess sa iya physical examination naman. Maagyan naton in the future kung mag-ret them nakamo return demonstration. That's why you have to choose your partner, okay? The nurse uses a structured head-to-toe examination to identify changes in the patient's body system, head-to-toe or cephalo-caudal, okay? An unusual abnormal finding may support the history data or trigger additional questions. Purpose of nursing assessment is to determine the patient's health status. Guys, liwat-liwat gid siya. As I've said, ang nursing liwat-liwat gid. Mugyapon, di ba nga, assessment para mabalaan naton ang health status sang patient, risk factors, blah blah blah, kag makagtunawan kita sa planning o aram naman ginambaya naman for education as a basis for developing a nursing plan of care. Okay, pagtapos assess, pagtapos examine, plano dayon. Okay, so liwat-liwat lang na siya guys. Ari na ginamba ko na the nursing process siya guys. Una gid permisi assessment. Okay, is the ability of the nurse to extrapolate the findings, prioritize them, and finally formulate and implement the plan of care, o plano naman, and overall goal. Information obtained throughout the assessment, documented, clear, concise manner, information escalated, and patient's medical records. Diri na record tanan nga state or tanan nga ano about sa patient's medical records ang iyang ang process bala kag ang plans diri na. Nursing process. The nurse uses the nursing process, a problem-solving process to identify patient problems, set a goal, and develop an action plan, implement the plan, evaluate the outcome, blah, blah, blah. Okay, the nursing process steps are, guys, tandaan, best friend nyo gid ni halin sa una hasta sa ulihi mag-nurse na kamo, best friend nyo gini guys. Okay, si Adpai. Tandaan, si Adpai, best friend nyo gid si Ad. Okay, una, assessment. As I've said, kagina, liwat-liwat lang, pinakauna gid si assessment, okay? Hindi pwede nga pagkita mo sa pasyente dayon, planuhan mo siya dayon. Okay? Ano ka sindikato? Okay? Guys, pagkita sa patient, assess dayon, okay? Ano ning problema sa patient? Something like that. Unay, grabe ya ubos. Ano na? Okay? Assessment dayon. Okay? Hindi pwede nga magdiretso sa evaluation, sa implementation, kung wala pa sang assessment. Dapat assess anay. It is what? It is the first step of the nursing process. It is the subjective and objective data gathered during the initial health history and physical examination and collected in each patient encounter. Pagtapos na assess, diretso na sa diagnosis. Ang minamba nila nga ginadiagnose bala. Okay? Has a nursing focus and is based on real or potential health problems or human responses to health problems. Okay, health problems. The nurse uses clinical reasoning to formulate diagnosis based on the assessment data and the patient's problem list. Okay? Mm, okay. Diagnosis, ginamo diri na diri na nagaobra ang nurse ang diagnosis sa diagnosis pagtapos sa assessment i-diagnose ng patient kung ano ang mga ano ang naga-exist nga sakit no potential pagid nga health problems risk siya sang something mga muna bala and next is planning. Okay? Pagtapos diagnosis, na-identify nyo ng problem. Okay? Nakita nyo na, ay, ala, nahilanat ang patient. Okay? Pag-assess nyo, do kakapoy sa patient. Tapos, yung kaptan nyo siya, ay, init gid man siya. Okay? Tapos, check nyo, taas gid man iya nga hilanat. So, i-diagnose mo nga may hilanat siya. Okay? Direct siya. Sorry. Then, planning, anong plano? Anong plano kay bangod nga mahilanat si patient? Planning is what? Devising the best course of action to address the patient's diagnosis. Okay, to address the patient's diagnosis. During planning, the nurse and patient select goals for each diagnosis in order to alleviate, decrease, or prevent the problems addressed in the nursing diagnosis. So planning, planuan mo ula paano tani panubuon iya nga hilanat man. Okay, kung balaan man hilanat, kung bako nagainit siya, may infection. Okay, so paano panubuon? O muna. Plano, painom bulong every 4 hours, sibinan, okay, mga muna bla, water therapy, etc. Di na siya makadto sa implementation. Okay, pagtapos ng planning, planuhan na, i-implement mo na. Okay, implementation of the interventions can be completed by the patient, the family, or members of the healthcare team. The interventions should clearly relate to the nursing diagnosis and plan goals. Of course, ang imo nga implementation connected gid dapat sa nursing diagnosis, sa imo nga planning or plan goals. Okay, syempre nga nag-diagnosis ka pa, tapos nag-planning ka pa, tapos lain gali mo implementation. Di ba? Evaluation. Tapos na tanan, pagtapos implementation, i-evaluate mo na ano, effective bala ang nursing care ng ginobra mo, no? Nagdugang or nagnubo ang iyahilanat. Okay? That's it. Evaluation is a continuing process to determine if the goals have been attained. Tara na ganun ba ko? If the goals have been attained, the nursing care plan is revised based on the patient's condition, whether the goals are realistic or appropriate for the patient. Types of health assessment, okay, the admission of new patient to a clinic, hospital, long-term care facility, or visiting nurse agency usually requires a comprehensive health assessment. Okay, comprehensive health assessment. Una, a focused or problem-oriented assessment where the nurse focuses on gathering information about the patient's problem. A focused or problem-oriented assessment, amo ning mga normal na itong assessment sa hospital. Pag-abot, okay, lain matsyag sa pasyente, o pamangkoton assessment problem-oriented diin naghalin nga nagsugod mo ni anong ginubra mo na okay a follow-up history is a form of focus assessment follow-up history follow-up okay nag-follow-up lang meaning may tawag siya is focus assessment kay nga naging follow-up lang meaning focus ka kung ano ang ginagyan or ano ang history ng patient so naga-focus lang kita kung ano ang problems ng patient sa past okay history next emergency history amo na yung gadali na guys okay wala na yung chinpo yan no ginkaon mo sang aga mga something like that okay that's your emergency history is the data collection which focus on the patient's emergent problem with systematic prioritization of need beginning with the ABCs of airway breathing and circulation guys okay wala na niya assessment or mangkot-mangkot pa diretso dayon mangkot or check dayon kung nagaginhawa pa kamusta yung ginhawa kamusta ang circulation ABC okay that's your emergency history guys please answer check for understanding sa inyo modules isend ko lang um, check for understanding nyo soon sa G